Walking, bending, throwing, dancing, even scratching, just about every move we make depends on our musculoskeletal system. We're talking bones, joints, ligaments, tendons, and muscles. And when something goes wrong, they can bring life to a standstill. So, who do we turn to? Well, today we have Dr. Alexander Vanderven. He's an MD orthopedic surgeon with Baptist Health Orthopedic Care, and he's here to share his knowledge with us as well as answer your orthopedic questions on this episode of Ask the Doc, No Appointment Needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, Miranda Kahn and here, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from Lisa, who reached out to us through our website. Again, that's allhealthtv.com. So Lisa's question is, hi, doctor. I'm an extremely active 66-year-old woman with a very physical job. I run a stable where we board nearly 24 horses. And I just had my second hip replacement. I had my right hip done, and then more recently, my left hip. And I'm feeling good, but to tell you the truth, I felt better after the first hip replacement than I did after the latest one. I'm concerned that I'm not really recovering as well. Are there any exercises or suggestions you have to help me get back to full speed a little faster? Dr. Vanderven, Lisa asked a really good question. So what can she do to help rectify her situation?
Yeah, I mean, it's such a common complaint, Miranda. Uh, Typically, when someone comes in to have a joint replacement, they're going to have an experience in their recovery, but typically we will try to exceed their thoughts about going into it. And especially with hip replacement surgeries, patients do really well and they have a really positive and quick result. And then very often when they come in for their second, which doesn't always occur, but sometimes they do need to have their other side done, they often will do the surgery a little sooner than they did with the first. And they often are a little bit disappointed that their recovery is a little bit slower. And this is a very human response. There's some neurological changes that will occur after the first one that may make the second surgery a little bit more uncomfortable, a little bit more pain. But ultimately, the end result will be the same as the first surgery. But very often, most patients will see a little bit of a lag. Of course, if something seems really wrong, you should get checked out by your doctor.
Well, that's helpful to know. So heads up, doc, we've got a YouTube question. This one comes from Daryl. Daryl asks, hi, Dr. Vanderven. My 86-year-old father-in-law has a terrible problem with arthritis in his knees. Now, many of his friends swear by knee replacement surgery to cure the pain. Is he too old for that kind of operation? I mean, he's in pretty good health other than the arthritis. He takes medication for blood pressure, cholesterol, and diabetes. So before Dr. Vanderven responds, let's check out this video from the folks at the Mayo Clinic.
Knee replacement surgery often is done to relieve severe pain from wear and tear arthritis. Mayo Clinic's Dr. Charles Hannon says robotic surgery has many advantages.
So it allows for better reproducibility, more accuracy, and precision as we're performing the surgery, reducing some of the human variability that will be there as we perform the surgery with manual instrumentation.
He says robotics serve as a valuable tool that can aid in the pre-surgical stage.
In certain systems, it allows us with a CT scan to better identify the patient's anatomy and to plan the patient's surgery in real time before we get into the operating room.
Doctors can then individualize surgery to the patient's needs.
It allows us to make very nice fine-tuned adjustments within half a degree and within half a millimeter of the implant position to optimize the patient's function.
Dr. Hannon says robotics provide real-time data on knee function during surgery, and the use of data extends beyond the operating room with remote patient monitoring.
We can monitor a patient's progress after surgery, identify a patient who may be struggling, and then hopefully can change their recovery trajectory after surgery to better improve their outcome.
For the Mayo Clinic News Network, I'm Jason Howland.
All right, Dr. Vanderven, let's go back to Daryl's father-in-law, again, 86, and has arthritis in the knee. So just how old is too old for knee replacement surgery, in your opinion?
Yeah, another great question that we get quite a bit. I would say, there's a lot of things we're looking at when we're evaluating a patient. And I would say that age is probably on the lower importance of how we have our discussions with patients. And so the studies show that there are many studies that show that octogenarians, meaning patients in their 80s, will do extremely well with their results with total joint replacement surgery, and specifically total knee replacement surgery. In fact, the pain scores and the satisfaction scores are some of the best based on, if you break it down by decades. We do know that some of the functional scores, though, are going to be less as the patient gets older. And that's just because you have to imagine there's other things working against them. Sometimes their back, sometimes it's another joint. And so although they have great pain relief, we know that their functional improvements, meaning how much more are they going to walk, how much more are they going to do, those will decrease as patients get older.
Well, I would say that's very encouraging news. So good to know that. So this question is from our Facebook page. It's from Rena, who asks, Dr. Vanderven, I'm a 45-year-old woman who loves to run. I don't want to stop running, but I'm concerned about my knees. I stretch before running all the time, and I'm careful to change out my shoes on a regular basis. What other tips would you recommend so I can keep running for many years to come? Doctor, I'm sure a big part of our audience watching right now is paying very close attention to this question.
Yeah, and I too am a runner, and I worry about this same question. And we need to get that out of the public's view that running is somehow a problem on the knees. In fact, it's not correlated to knee arthritis in any way, as long as you haven't had a previous injury. So those patients who've had maybe a major sports-related injury, those are the ones that might need to be a little bit careful with distance running. But running is not associated with premature arthritis of the knees. Now, if you run every day, you're going to get overuse injuries. You'll get anterior knee pain. And so you can't overtrain, just like you can't overtrain for any sport or activity. But, a careful, thoughtful, regular running schedule can continue for years and years. Of course, it's probably helpful to keep your weight under control. And it's also important to do appropriate warm-ups and make sure your pace is okay. Of course, you mentioned the footwear. With regular changes based on the recommendation of the manufacturer. But really continue to run and keep yourself happy as long as you can.
Yeah, because you're doing it yourself. I'm so glad you cleared up that myth because I'm sure a lot of people have heard that. All right, in case you missed it the first time, here is another opportunity to find out where to send your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, up next is another question from our allhealthtv.com page. This time it's from Carlos. So Carlos asks, hey doc, I was an athlete in college and I played basketball and baseball. I had several knee arthroscopies back in the day, and my knees have been pretty good over the years, but I'm heading into my 40s now. And as an avid weekend warrior, I still want to play basketball and softball as much as I can. Problem is, I still think I'm an elite college athlete and I play all out. So how can I protect myself but still play the game I want to play? Carlos, thank you so much for reaching out to us with your question. So, Doc, I'm sure a lot of former athletes, high school, college, and pros have that same mindset. So, what can or should they do to help prevent injuries?
Yeah, Carlos, credit to you, and you hold on to that youth. Listen, we know some professional athletes are highly functional into their 40s. Of course, even they, like Tom Brady, had to make some adjustments as the birthday candles pile up. But some things you're mentioning that do concern me a little bit are the multiple arthroscopies, which may suggest that some of the structure of your knee may not be where you want it to be. You are probably a little bit of higher risk of some recurrent injuries, but of course the most important thing is get checked out by a specialist if you can to see where you're at. If the structure of your knee is solid, you can really go ahead and do anything you want. Now, maintenance of your health and injury prevention are extremely important. And so you want to make sure you warm up correctly. You want to make sure that you've taken care of yourself and cross-trained prior to engaging in these weekend, high-level competitions. And so a combination of strength training, balance work, flexibility work are going to be really important. Maintaining healthy diet, keeping your weight in an appropriate level. And the most important is just listen to your body. If you find that it's telling you something, you should make some adjustments.
Well, good advice. So we've got another YouTube question. This time it's from Alana. So Alana is asking, hello, Dr. Vanderven. My 65-year-old grandmother recently had a hip replacement and she's still in real pain. So you were talking about watching your body, doc. So she had the procedure about 6 months ago and she's still suffering. Her doctor isn't very responsive to us, and I'm wondering when it would be time to speak to another orthopedic surgeon about maybe going back in to see what's causing the problem. Oh, this is a good question, Alana. So, doctor, what are your thoughts about getting second opinions?
Yeah, this is a frustrating scenario, and we hate to hear this.
Mm.
First of all, having a hip replacement, you should expect to be relatively pain-free within the first 2 months. And so 6 months, I agree, is running a little bit long, and it does warrant an evaluation. It's going to be, very often, just like if you think about any type of surgical intervention, almost compare it to, doing a home project. It's very hard to have a contractor come in the middle of a project. And so really, if a surgeon has taken you on as a patient, that surgeon should be invested into your recovery until you are fully recovered. Sometimes a friendly reminder to the office staff or a nicely written letter can sometimes re-engage that surgeon. And so don't necessarily give up on that surgeon right away. That surgeon is going to be the one who has the most insight into what's going on with the condition. But if you're looking for a second opinion, surgeons will take second opinions. You should try to get as many medical records together. Sometimes some of the x-rays, the preoperative imaging, the imaging after the surgery, and try to send that in so another surgeon can evaluate you.
Mm, that's good advice. I know a lot of people that keep their records on hand, and that's very important. So, doctor, this next Facebook question is from Emilio, and he writes, Hola, Dr. Vanderven. If you have one knee replaced, is it usually, and I know you kind of touched on this, but going through the question, is it usually just a matter of time before you have to get the other one replaced? Would it make sense to get them both replaced at the same time? I mean, I know I'd be off my feet for a while, but at least it would be one recovery period for both knees. What do you think of that plan? Emilio, thanks for reaching out. You touched on this a little bit, doctor, but I mean, it kind of makes sense to me. But what are your thoughts? You're the doctor.
Yeah, and I have this conversation a couple times a day, every day, with patients asking the same question. And so you want to tailor this really to the individual. Doing one knee is a lot. Doing two knees is like triple a lot. There's a physiologic load that occurs when you have one knee replacement, but physiologically, a lot more will happen to your body with second. The amount of inflammation that occurs, you're going to have double the blood loss, and you're going to really feel the effects of the surgical trauma. But there is the benefit of only having to recover once. A knee replacement, the actual surgery is just a small part of the overall surgical experience. It's the rehab and the recovery that I'm sure a lot of you know about. You're talking probably a good 2 months of rehab and then potentially a year to fully accept this intervention. And so if you do this once and you do it again the next year, you're talking potentially 2 years of recovery time.
Yeah.
Whereas if you do both at the same time, you can cut that down. People who work, people who don't have a lot of paid time off, there's a benefit of doing both at the same time because then you lose a lot less working days or vacation days. But if you have the time, as I told my dad, he had knee issues in both knees. He asked me, should I do both at the same time or do one at a time? And it was a clear answer for me is you do one at a time. But I know his personality and I know how he was going to recover. But if you're going to do both, you really are going to want to do both, meaning you got to show you're extra motivated because it is physiologically a lot on the body to go through a double knee replacement.
That is
The
really
second part of that is make sure you have identical disease, meaning if you have one bad knee and one other knee that's, marginal, I would really address just the bad knee because if that bad knee becomes your good knee, then maybe your other knee can put up with it for a little bit longer and you don't need to rush into that decision.
Yeah, that's really good advice. And I mean, obviously, you're speaking not just as a doctor, but as a son. So appreciate
Yeah.
that. So, doctor, we've got another question from YouTube. This one is from Jerry, who asked, "Hi, Doc. My wife is a very active tennis player. She loves the game, but lately she's been complaining about pain in her knees when she plays tennis, and the pain lasts not just that afternoon, but into the next day as well. I told her she should get it checked out, but I think she's a little scared that she'll find out that she needs a knee replacement. Her dad went through that about 15 years ago, and he had a rough recovery. So, what would you suggest that she do?" Jerry, first off, you're a great husband. Thank you so much for reaching out. Doctor, what are your thoughts?
Yeah, I mean, the fear of having knee pain and just needing a knee replacement is the solution. We also want to dispel that rumor. Not everybody with a sore knee is going to end up with the long recovery. The most important is to get checked out by a specialist and figure out what's going on. Yes, tennis is one of those sports that really puts a lot of torque on the knee. And if you have a pre-existing injury, you will feel that discomfort quite a bit more. But one of the problems is if you develop a pain or a discomfort, very often we malcompensate and we start to use accessory muscles, which will cause other aches and pains. And so sometimes getting an evaluation and a trip to a physical therapist can reverse all of that. And doesn't mean you're going down the road of needing a knee replacement surgery. In addition, there's other treatments that can make people feel better, that can keep them playing their sport. Again, there's medications, there's sometimes injections, knee braces, education sometimes alone can fix the problem. And so it's not always the end of the world to have a sore knee. Just get a diagnosis, and then start a treatment plan and make adjustments. Communicate with your physician that if something's not working, there's other options out there.
Yeah, that's good to know. Some relief out there, I'm sure. Just don't jump to conclusions. Good advice. So, if you've got questions, guess what? We've got answers. And just in case you missed it, the first couple of times, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, this next question is from Maddie, who reached out to us on allhealthtv.com and saying you should, and by the way, I just want to mention this, you should really check the website out when you get a chance. I mean, it is just chock full of great information. Just saying. All right, let's go back to Maddie's question. So here's what she says. "Hi, doctor. What are the most common orthopedic conditions you see today, and how have they changed over the last decade?" Maddie, top-notch question. Dr. Vandeven, don't you think so? Keep sending in your questions. So, Doc, let me ask you, what are your top 3 to 5?
Yeah, so as an orthopedic surgeon, we're going to be seeing orthopedic related problems. Some are acute, meaning they recently happened. Some are more chronic, meaning they've been developing over the years. I'm a joint replacement specialist focusing on hip and knee disorders. So, of course, the most common for me are going to be joint related problems. And the most common is going to be osteoarthritis, meaning a loss of cartilage leading to secondary changes like stiffness and pain. Um, we also will see some soft tissue injuries, so some, um, you know, soft tissue pains, aches and pains, things like bursitis or tendonitis commonly can affect the knee and hip. And so just because you have an ache and pain doesn't mean it's the end of your joint. And then in this population of patients who have hip and knee disorders, a huge percentage of them will have a spine-related problem that can often aggravate that. So arthritis of the lumbar spine, pinched nerves in the back can often aggravate that. And that's a really common problem that us upright human beings get as we age. And so those are going to be really the most common things we see.
All right, so this question comes from Logan, who reached out to us via Instagram. Logan asks, Dr. Vanderven, I'm a trainer at a local Division II school, and I've always been curious to know how or why an orthopedic surgeon ultimately decides between repair, reconstruction, and or replacement surgery for a patient. Logan, that is a great question. I'm kind of curious myself, Doc.
Yeah, so the question is a repair or replace.
So again, we'll try to get contact with the doctor again. In the meantime, we want to go ahead and go to some of your other questions. We're going to get to that in just a moment. But for right now, here are some ways that you can learn more about Ask the Doc and join the conversation.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com. Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, welcome back. So we've been talking about taking care of your bones, orthopedic care, your joints, your ligaments with the doctor. In the meantime, I want to just pop up some things that you can do to stay healthy. So you're seeing it on your screen right now. These are just little things that you can do to keep your bones and your muscles healthy, like making sure that you're taking calcium and vitamin D. You heard the doctor talking about how important it is to keep a healthy weight. And a lot of this comes through strength training and having a good balanced diet, not smoking. Doing some of these things are really going to make a difference, and staying hydrated. I know it sounds really basic, but it could mean a lot. I think the most encouraging thing that we've heard throughout the show today is that age doesn't determine everything. A lot of you have been asking questions. I'm in my 40s, I'm in my 80s. What's going to happen to me? Am I too old? And you heard the doctor. No, that's not always a determining factor. In fact, don't base it on that. He's saying, as long as you're healthy and you're fit and you're having that relationship and you're being honest with your doctor and you're maintaining a healthy weight, you're going to be in pretty good shape. And it's not a one size fits all. We're all different. We're all different and we all have different needs. And I think that's really important. And I'm so glad that you've been submitting your questions. We've just learned a wealth of information. I don't know about you, but I think my biggest takeaway, because I've heard this over and over again, that running will ruin your knees. But the doctor, you heard him, Dr. Vanderven said, nope, I'm a runner. I encourage you to continue running. Now, he's not saying run a marathon every day. Obviously, that's going to have an impact, but he's saying don't believe the myths that you find out there. And we've learned a lot about, people wondering, if I get one hip replaced, does that mean I'm going to have to get the other one? And the doctor said, no, that is not the case. It is not a one size fits all. So make sure that, you keep that in mind. I think that is just so important for all of us to keep in mind, that it's not a one size fits all whatsoever. So I'm just glad to hear that. He shared his personal story about his father, and he said, you know what? It's a lot. If you want to get your knees replaced or both hips at the same time, that can be tremendous. Yes, it may save you some time, when it comes to recovering or taking time off from work. But, he's saying, make sure you have that conversation, because it might make sense, for one person and not for another. So again, we encourage you to go and visit our website. Join the conversation on social media. We want to hear from you. What are your health questions? And be sure and tune in, because we're learning a lot of information. Again, that's all the time we have today. Thank you so much again for Dr. Van de Ven and all of you for submitting your questions. I'm Miranda Kahn, and we'll see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,